and welcome into To Your Health. And we have again with us, we're so fortunate to have Dr. Wick Many. And Dr. Many is the former dean of the UAB Medical School in Montgomery, Alabama. And he is an infectious disease specialist. And we were discussing how far treatment for so many things have come. And Dr. Many, it's encouraging.
It is.
Are you seeing a lot of improvements?
Well, obviously, from the time that I was in medical school and training, and even in practice, 5, 6 years ago, the evolution of the treatment of so many diseases, rheumatological disorders, particularly cancer, has evolved with the understanding of the molecular basis. In other words, the actual cell that's causing the illness and how it expresses itself as far as its genetic sort of markers. We call them genetic markers. Okay. This is not genetic like, whether you have brown hair or red hair. These are genetic markers on the outside of the cell. And as we discussed earlier, there's always a silver lining in some way. So the science of understanding these markers began with the HIV epidemic. So in the early days of the HIV epidemic, research was being performed to find out why the HIV virus was killing certain types of white blood cells and not others. And we came to understand that there were markers on the outside of these cells that the virus particularly attacked specifically and not other cells. And that has, over the years, has become now actually part of every aspect of medicine, is how these different markers on cells will dictate the types of treatment and will also dictate the prognosis, good prognosis, bad prognosis. So in the case, say, I'm not a cancer specialist, I'm not an oncologist, but now if someone is diagnosed with a cancer, and of pretty much any type of cancer, whether it be breast cancer or other types of cancers, in addition to looking at the tumor cells underneath the microscope, the pathologist will send off a special study where they will look for these various markers on the outside of the cancer cells. And some of these markers, sometimes it's good to have a marker, sometimes it's bad to have a marker. Some of these markers indicate a favorable outlook, some of these markers indicate a poor outcome. They will dictate how aggressive to be treated, not how to be aggressive. So if an individual, we'll just say prostate cancer, which is very common in men, individuals with the same stage of prostate cancer, if the genetic markers are favorable, the physician may choose just to observe the patient and not even treat them. In other words, just see the cancers go so indolent, so slow growing that it does not need treatment. The same sort of stage of cancer, but in a different person that have different markers, they'll choose to be much more aggressive. So it has really made enormous difference in how physicians can choose. And again, the same thing is done particularly in a lot of rheumatological diseases, where they can look to see if you have various and sundry markers for various rheumatological diseases or blood disorders. So again, this research is, in the future, when you get a diagnosis, you're going to get a test, not necessarily for the blood specimen or something like that. They'll get a marker for what type of marker you have, and they'll put it in a computer, and something will spit out, and here's a treatment for you. So it's this is the future of medicine. I mean, this will now be standard care to have these tests performed if you are undergoing some form of treatment, particularly cancer chemotherapy.
And AI will play a role?
AI will play a role, for sure. It already has.
Yeah.
It already has. I mean, it's and because with AI you can digest so much more information in a very brief period of time, whereas individual would take days, weeks to sort of research all the various scientific articles on a various disorder. AI can spit it out in 35 minutes.
And thank you for being with us, and there's hope out there, and we'll be right back.